Yeah, well, and 10 minutes, because when I do it an hour, I'll be distracted in the hour.
Oh, okay.
Well, Mark, to your comment, at least, I mean, I guess we can talk about it.
Yeah.
In more depth than we did last time, now that it's on the agenda.
Yes.
Are we called to order?
Call to order, and I'm gonna turn off my camera while I eat just because I feel weird. Is that okay with everybody?
Yeah.
All right, so do we have any citizen comments come in via
No.
email or you never do?
No.
I have a question for Constance. So you shut off your camera, but can you see us?
Yes.
Okay, so if we raise our hand or try to get recognized by the
Oh,
chair,
absolutely.
Yes. Okay, thank you.
Do you want to get recognized right now, Mark?
No.
But on to our discussion items, the after hours transportation issues.
Well, we recognize that.
Oh, sorry, I was
already-
looking down. I was stirring my food. What? Yes, Mark.
Well, were you going to make introductory remarks or let Nikki make introductory remarks, or I can dive right into the topic?
I think we can just dive right in.
Well, Nikki, as you said, we had some sort of a discussion last month on this idea of putting it on a future agenda. And you didn't really want us to go in depth on it. And I'm not going to go in depth on it because nobody's here to hear about it. But for the record and for the minutes, let me lay out what the two issues are. They are distinct but related because of being after hours. And they have arisen in the last year or 2 years recently. So one is people, now we're talking specifically, you have it correct on the agenda, for people with disabilities. Obviously, it affects anyone who doesn't have a car. But the purpose of this commission is people with disabilities. Is if they have a job, and the job, a lot of people with disabilities, physical or mental, often work non-peak time jobs. So they're working evening jobs or weekend jobs. They're the kind of jobs that they often get hired for, and they get off work and the bus system isn't there. And how do they get home? So that presents a big issue. And they don't drive. They're disabled. That presents a big issue. It was attempted to be addressed over in Asotin County with a great big grant that Asotin County Community Services got, like $350,000 for a 3-year period. This is the last year. And they subcontracted it out to COAST, C-O-A-S-T, out of Colfax. That stands for Council on Aging Surface Transportation. And COAST was to provide that service. It was heavily advertised. If you lived in Asotin County and you needed after-hours transportation, call COAST. Well, unfortunately, COAST couldn't find enough drivers. They could not keep up with the demand. The program never unfolded the way it should. As I understand it, Asotin County Community Service sort of kind of revoked the grant and they took over one of COAST's vans. It helps to have a wheelchair lift if you're gonna, which Interlink doesn't have access to. And they were providing the service at least for their own clientele who are disabled, who are working. Asotin County Community Service provides services like OUI does. And I don't know, you work at OUI? Constance works at OUI.
I do, and I know some folks that work at Asotin County Community Service.
Okay, so I'll pause here in just a moment and you can augment this. I don't know if you have clientele who get off work after hours and who gets them home, but
Oh, absolutely.
they took over a COAST van to provide it, but now suddenly you had to be a client of Asotin County Community Services as opposed to they weren't gonna drive someone just from the community. And we, because we tried to refer them, somebody who, a disabled person who lived in Cloverland. Y'all know where Cloverland is, out in the middle of nowhere,
Way out toward Anatone, right?
which, well, but it's not on the Anatone Highway. But it's above us, so,
Yep.
up the creek. And they wouldn't do that because that person wasn't one of their clients. So that's the issue with working people, disabled working people who either get off work in the evening or work on a Sunday when there's no public transportation, or there's limited public transportation on Saturday. I'm not exactly sure what the hours are. And it's a community problem that nobody seems to be wanting to address. So before I go on to the second category, I'll pause. And Constance, how does OUI handle this?
So for OUI's vocational, which is not my program, so I can't, don't take me as an expert in it, but I do know that if somebody works in the community, they will have a job coach. And from what I understand, that is what Asotin County Community Services does, is they provide job coaches to people with disabilities. And for that, the company is reimbursed for mileage for their clients. Medicaid pays, Jess, right?
Yes, that's correct.
So that is probably why Asotin County Community Services would not provide transportation to somebody who is not one of their clients, because they would not be reimbursed for it. So I guess my question would be, so if they received a grant for $350,000 for 3 years, where is that money? How is that money being spent?
Madam Chair,
Matt?
I don't know that we really need to bark up that tree as much as just identifying how we can serve the folks on this side of the border as part of this commission. Am I wrong?
No, you were
No,
actually
you're right.
way to keep it on track, Matt. I appreciate that.
I'll just answer your question in the terms of it wasn't government money. It's a private foundation that only serves Washington. I think it's called Dan Thompson money that counties can apply for. And that's what they applied for. Well, Coast got to buy a brand new van out of some of that money. But more to your point, that money was to provide transportation for disabled people of any kind, of any disability. You didn't have to be a client of community service. You didn't have to be on Medicaid. You just had to live in Asotin County. So, that's why we referred someone to them. But in a way, they're kind of not meeting the requirements of the grant, but we're not the grant police. So anyway, that's that. The question to you is, does OUI have client employees who get out of work after hours or work on Sundays? How do they get home?
Oh,
I can
I-
answer that for,
Yeah.
oh, sorry.
no, well, and
Um,
Jess would know better than I would, because again,
I think the answer is that if they're capable, they walk, and a lot of times in very dangerous conditions. And then oftentimes they pay out of their paycheck cash for people who they know to give them rides, which then comes out of the very little money that they're making in income regardless. Or they just don't work those hours because they don't have transportation. So if they can't access public transportation, other than trying to find a natural support or getting there by their own means, is really right now, as far as I'm aware, the options that they have.
That corresponds with what I see in my industry as well. It limits access to employment after hours significantly for many of the folks that I serve.
Well,
and-
you work for a home health agency.
Home care, but yes.
And I don't know how many of them would get off of work after the buses run.
I have several that would work more if they could.
And then, of course, as always, there's Sunday work. But you raise an interesting point because I used to work for a care facility. And a care facility, like a hospital, like Clearwater Paper, is a 24-hour-a-day, 7-day-a-week service. And just like what you said, now those people aren't disabled, so that's a workforce issue. That's off the domain of this commission. But the ones working like the graveyard shift, and there's no bus. We had one who walked from Wedgewood Terrace to North Lewiston,
Yeah.
back and forth for her job. It worked nights, and I just was like, oh my God.
I had a young man walking, from up kind of by like Hot Shots down that Nez Perce grade, which is just not, or I don't know if it's the Nez Perce grade, but it goes right down to Sportsman's Warehouse, that area. And I mean, that's just in the dark, you know, it's just not real ideal, and safe at all times. But every once in a while, if they have one-on-one res hab and the staff are willing to work, sometimes you can coordinate their hours with their staff to where they're dropping them off at the end of their shift or picking that, you know, so sometimes it matches up to where you can incorporate that a little bit, but with those after hours, it just makes it really difficult to find staff who want to do that and work those hours. So there's a lot of barriers there.
I'm sympathetic to, if Suzanne were here, the head of Lewiston Transit, you know, she would say it's just not cost effective for a community this size to run a 24/7 public transit program. We don't have enough riders during the day to pay for it, let alone what we'd have in the evening. I don't remember the answer. I asked her one time a year or two ago, well, why can't, we're talking about disabled people to a great extent, why can't Dial-A-Ride operate longer hours? I think the answer, but I'm not 100% sure, is Dial-A-Ride can't operate any more hours than the regular public transit program. Do you know, Leah?
I do not.
Yeah, so you'd have to,
Peterson speaking.
yes.
I do know. And, the Dial-A-Ride can only operate within the zone of the existing transit system and during the same hours. If you are going to have the ADA buses and personnel work at later hours on a separate thing that's totally funded by however source, other than the federal funds that are coming, you would also have to allocate the accounting for the use of those equipments, the maintenance, et cetera, along with the employees, their wages, et cetera, between the two. So it's not a simple operation. And just for your information, I don't know of any bus systems anywhere that are fully paid for by the people using it as transit.
Well,
Around here, the DC Metro system, no way.
yeah, that's absolutely true. I didn't mean to imply that passenger fares cover all the costs in any way, but the idea that the need would be limited and episodic, so you wouldn't need to run a fixed route bus system all night long. It is more like a door-to-door system. And before I talk about the second challenge, which is different but similar, I'll just throw in there, because of what you said, Jessica. If we had a more robust taxi cab / Uber system, then that's what you would expect people to do, even though that is not inexpensive. Those are expensive options. But as I understand it, there's only, what I have been told, there's only 2 Uber drivers in the valley, and they only work occasionally when they feel like it. And I don't know if this is true, but somebody mentioned that what taxi cab services we have, they don't operate all night long. They shut down too. I think maybe after the last flight arrives at the airport or something like that. And so that's not an option. So now keep that in mind. The second issue, which I think I mentioned last month or in the past, is the people that the hospital, specifically St. Joseph's Hospital, releases after hours, after the bus system stops working. And I use that word advisedly because as opposed to the word discharge, I had to be trained in this. They discharge a person who has been admitted and has been a patient there overnight, at least one night, and they would never discharge a person after hours. But releasing a person means they've presented at the emergency room for whatever purpose and they're not admitted, they're just treated for whatever, indigestion or hangnail or whatever. And they very possibly came to the emergency room by ambulance because they thought they were dying. And they're treated and released. Well, they could be released at 8 p.m., 11 o'clock, 2 in the morning, 3, 4 in the morning, and, or obviously all day Sunday, and they have no way home. They have no way home if the bus is not running. And they'll call Interlake, and our drivers don't work those hours either. They don't have a bus. They were the ones who told me taxi cabs aren't available after a certain time. And almost by definition, we are talking, I mean, some of these people might qualify as disabled and a lot of them don't. A lot of them are elderly, apparently. But they, you know, they might even drive and have a car, but they didn't come to the hospital by car. But by definition, they don't have any relatives or friends to call. These are the solo seniors or the solo lonely people. They literally have no one they can call to take them home. And the hospital says they end up staying all night in the waiting room at the hospital until the bus service starts the next morning. And that sounds horrible. The only other alternative, and that's why I wanted the fire department here, the ambulance will take them home, but then they'll get a bill for $300 or something like that, is what I've been told. So, any comments about that? It's a very different phenomenon than working people, but it's still a need for after-hours transportation, which is the agenda item. After-hours transportation for which our community's answer is you're on your own. Any thoughts, Eric?
Well, I come back to the financing and the availability of transit. One is indeed the ambulance service. They would need to probably have more staffing because they don't want to leave response time in a bad position if they're transporting people. As to the vehicles, they wouldn't need to have in the ambulance department, an ambulance. They could use fleet cars that are already owned by the city, let's say. So that's a viable option, and the city could contract with, say, these other services like the ambulance, not the ambulance, whoever does the Medicaid transport and the taxi, Uber type thing, they could actually do a contract for a service if the city decided that was a service that was important to us, which they already have by actually having the transit system in existence. This would address a different area, and what the cost would be, I think that's where a preliminary study would be of value and could possibly be done by the city, or someone could contract out for an initial analysis, like doing a traffic study. You'd be doing a study of this use. And I think that's actually a viable approach we could use to present to council recommendation if we did our background work. I think it'd take us a while, but I think that might be a pretty valuable contribution and a way of actually getting a reasonable funding approach using existing equipment, using existing personnel, and actually having them in the same system so we don't have that problem with the use of the buses and the dial-a-ride where we're dealing with federal monies and the allocations and the accounting for it. So that's my thoughts. I'm done.
Constance, can I speak more?
Absolutely. I'm doing some brainstorming, about, because Medicaid transportation, so my brain's just kind of going crazy right now. So you go, Mark.
Well, I'm glad Eric brought that up because all we're doing here today is sort of building a record of the problem, right, Nikki? So that reminded me that, so there is a difference. This points out a difference, not because of Medicaid per se, but between the two scenarios I laid out. The job scenario, the disabled person who gets off work after hours, okay, that's planned and that's scheduled and you would know the days and you'd know them days in advance. And by the way, that's how Medicaid transport works. I think they need at least 24 hours, maybe 48 hours notice. The other scenario, the hospital just releases somebody out onto the street. That's like, they want rides on demand. They want, I mean, that is a taxi cab Uber issue, which we don't have enough of either. And that's like on demand. Even if they're on Medicaid, they can't call Medicaid at midnight. First of all, no one will answer and say, find me a ride in the next 20 minutes. I mean, that's not going to happen. And of course, the hospital will tell you that, well, it's just not scheduled. People are released all the time. In terms of the quantity of what we're talking about, and I don't know, Matt, if your clientele are like this, if they go to the hospital a lot, you know, to the emergency room, and how easy it is for you to run records. But I was absolutely stunned when there was a group that met to discuss this issue under the umbrella of the Continuum of Care, which is a group put on by the hospital. They met back in May and they've never met since. But a representative of, well, let me not put their name in the record, but another home health agency. When I asked the question, well, how frequent is this? She whips out her phone, she touches a few buttons and scrolls, and she said, let me just tell you about our clients. She said yesterday, which was a Tuesday night, we were meeting on Wednesday. Yesterday, we had 9 of our clients go to the hospital. Well, to the emergency room. Well, after 4 p.m., but 9 who were released, 9 who went to the hospital after 4 p.m. She said of those 9, by the way, it took her less than 60 seconds to pull up this data. Of those 9, 2 were admitted. 5 were released from the hospital between 7 p.m. and 11 p.m. And 2 were released by the hospital between 11 p.m. and 2 a.m. And I said, well, how many of them had a way to get home? Someone to call. She said, I don't know. We don't keep those records. That's a lot. I thought that was a lot. That was one night, one home health care agency. Does your agency
Those
have,
numbers don't surprise me at all.
you have clients who go to the hospital every single day?
I have clients that go to the hospital every single day, yes.
Anyway, the hospital would probably have those figures, and not to sound cynical about it, but I posed the question, well, isn't this a hospital problem? Why are you trying to make it a community problem? Shouldn't you figure out, you're releasing people into your parking lot who have no way to go while they sit in the waiting room till the morning? Isn't this your problem? They don't want it to be their problem.
Right.
They don't want to pay for it to be solved. And as I said last month, there is a similarity. There are 2 different situations, the employed disabled people who get off work at night, and then these hospital people. But there's enough overlap for the topic to be discussed as you have on the agenda after hours transportation. But I don't know what the answer is. And it'll cost, as Eric said, no matter what it is, it'll cost money. Interlink has simply posed the option that if we were given money, we would try to solve it because we're not going to find volunteers to be on call all night long to give these kind of rides. Those would have to be paid drivers. Maybe not paid as much as the city pays their bus drivers, but there still would have to be paid. And we'd have to have revenue to run a program like that. So it's not impossible, but would cost some money. And that's about all I have to say. Constance, you said you were brainstorming.
Eric,
Oh,
Yes, Eric.
yeah, just following up on Mark's last statement he made there. And going back to you need to kind of do a study and kind of look at what the projected cost of others might be. And someone like Mark's, the Interlink, is actually someone already providing services and could fund, like they'd be even a good example, pilot example. Mark has the issue of a possible conflict of interest, which just, presenting for that, but I think that's something that can easily be dealt with. I think the real thing is starting on some sort of investigation of how it could possibly be done. Because we know it's a needed service, not wanted, but actually needed, really for our economy and any growth that hopefully we get someday. So I like the direction. I like what Mark has brought up. I think it's a very appropriate topic for us. And we may need guidance on how to go further on this, maybe from the mayor. But I think it'd be a pretty good priority item to list for a goal for us for this year and the following year is to focus on this along with the ticketing system that's currently being dealt with IT. Those are two major projects that have significant benefit for the disabled population. And even though the people who don't have a car aren't disabled, they are economically disabled. They don't have the ability to respond to the market because of their limitations. So that's enough for me. I'm done.
I think there's a lot to be said that I keep going back to just something as simple as community access. And not even necessarily that somebody's being discharged from the hospital at 2 a.m., but an individual with disabilities that wants to go volunteer at the rodeo. But that volunteer shift is until 8 p.m. I mean, just even being able to go to community functions is severely hampered. So it is, I mean, that's just me complaining. That's not bringing any solutions to the table whatsoever. Jess?
I'm just kind of thinking out loud, but we've kind of discussed how the transit system isn't operating during those hours because there isn't enough need to keep it operating, but it kind of makes me think, how do we know what the need is? Because just in the discussion that we've had, we've talked about lots of people that maybe we know that aren't accounted for, that do need those after hours rides and things like that. So it just makes me curious of, maybe the need is there, it's just not necessarily being tracked or documented, but how to do that, I don't know. I'm just thinking out loud.
Nikki, do you know how much, like, because you're part of like community studies, right? Where like surveys and stuff. What would
I'm not really. It depends on what topic.
Well, just like doing a survey to see if the community would respond to need for transportation after hours.
Oh, so you're saying like have the city put out a survey to the community asking for a response in how likely they would need or use a transit system in after hours? Is that what you're
Yes.
saying?
Yes.
Okay,
How would we
Yeah.
go about trying to establish a study like that?
we would want to work with the public information officer to figure out what it is specifically that we're asking for. And then you'd have to kind of figure out what are you communicating to the public would happen with that information,
Right.
because you can't really make promises.
Yeah.
But you're just looking for some sort of ability to track it or to figure out the actual need of it. So, you know, the PIO would want to work with this commission to figure out what is it that we're seeking and how do we properly communicate that to the community to respond to us.
Eric Peterson?
Eric?
Yeah, I'm again kind of going to Mark's comments and Mark's thinking way. He's very good at organizational skills and planning for the future. And one of the things we've done in the past, which we haven't done for a while, is actually set a time to focus on, we've got a vision and a mission statement. I don't think those have changed. But we haven't done any goals or such for a year or planning for that. Now, two that come to my mind immediately is one, the ticketing system, and now two is Mark's concept of the after hours and the significance of that. It would be nice if we had those stated as actual goals for the commission, so we have something to follow. We would need to have a scheduled time to actually discuss and then have it put down for a vote. And probably someone should lead that sort of thing. And I'm not sure if it should be the chair or we should have someone else do it. I think Mark could give a lot of guidance on that. So as to a topic is, I'd like to actually be able to put this on an agenda in the future. And probably not the immediate far future, but relatively the new future, or the near future. Any thoughts or comments about that? I'm done.
Mark,
Oh, you can see us, yay.
I told you I could.
I know, I was testing you. Yes, I am trying to organize this in my head. So there's, you know, the first comment is keep in mind two completely different things, even though they could have potentially a similar, possibly similar solution. The need for transportation on demand, like people being released from the hospital. And the other one would be more scheduled need, like people getting off of work, and that's scheduled in advance. Now, Constance, you brought up the third one I hadn't even thought of, and that is people wanting, it's not just a ride home, people wanting to go to an after hours event that they can't go to, they can't get to, and then they would need to be brought home. Whether it's for social reasons or whether it's for volunteering, like you said, or just a short-term job. So those are issues. I want to put on the record that nobody says this has to be free. I mean, the individuals could be charged, the ones who could afford it. It doesn't have to be free. But we're just recognizing that besides the fact that the public transit doesn't run after hours on Sunday, neither apparently does taxi cabs and Uber run late at night. And if they did, it would be expensive. And Sunday is a whole nother issue. Sunday services. And so, you know, what are the options in terms of who we would need to hear from? Just thinking out loud. The hospital itself could provide records in terms of after hours releasing people. And I believe they told us they don't keep a record of which of those people call someone and get a ride and which ones hang out in the waiting room or the parking lot. That's unfortunate, and maybe they should be asked to keep a record. Meanwhile, I'd be interested in knowing from the employment agents, the OUIs, whatnot, how many of their people are affected. I wonder if Disability Action Center might have a voice in this discussion. Apparently, you home health agencies have records, but that's again just hospitals, I assume. But your people by definition would qualify as disabled. Because that's the other thing I would say is this commission has to keep its focus on people with disabilities. And if people without disabilities can likewise benefit from this infrastructure, well, then, you know, more the better. But they're not the group that we're trying to assist. And I don't know, it has become a problem when it wasn't a problem in the past because people had family and friends that they could call. And it's going to keep growing. It's going to become more of a problem as the population ages and people move to the valley who don't know anyone and are more alienated. So it's not going to go away. Nothing is done, it's not going to go away. It's just going to keep getting worse. And apparently the private sector, like Uber, has no interest in solving it. Done.
Well, I think a lot to do with the Ubers and taxis and stuff like that. I mean, I've taken a taxi before, and to go 2 miles, it's $20. I
Yeah.
mean, that's a lot of money.
The
So,
average taxi ride in the valley, because we did track that number down. And that was like a year or so ago, is $28. One
Yeah.
way. That's the average.
so I think, as you said, doesn't need to be free. I know that for Medicaid transportation, Cheryl with Rideshare is fantastic at giving people rides when she can. And she charges a small fee to do so if it is not a Medicaid service.
Who is that?
Sure. Jess, you wanna?
Rideshare is one of the local Medicaid transportation
Oh.
provider agencies, and she also does offer at times self-pay rides that are after hours. I don't know the ins and outs of it, but she's great. So again, something like that might be more possible if there was an idea of like a demonstrated need of certain days and times where a self-pay situation like that would be needed, you know. Then having some conversations with some of those types of situations, but
Well, so I've never heard of her. How would people know of her?
basically just through word of mouth and like through me, because I'm a service coordinator, and so I work with her regularly and just reaching out to her and asking her about it. So most people probably wouldn't know about that.
And
Well, and again,
Constance, what did you say Cheryl charges for non-Medicaid purchase?
it
Basically-
depends. She typically will do it. Depends on how long. It also depends. I mean, she's suffering from the staffing shortage as well. So it wouldn't, she would not be a long-term fix. Meanwhile, as I was trying to brainstorm myself, it could be something like if the city could apply for a grant. I imagine that a service like rideshare, if they were able to capitalize on a grant, that there might be situations, again, I don't think 2 a.m. So again, it's not a long-term fix, but it could help alleviate some of the after hours transportation.
Why not 2 a.m? Well, I know what you're saying, and that's why the Interlink idea we haven't thought that deeply about it, but is to have paid on-call drivers who we would issue a cell phone to, who just, but there would probably only be one on duty every single evening. But they could be called, with the hospital being the main source of this need, and they would be called for when someone needs a ride. And then they wouldn't have to necessarily stay awake all night, but they'd have to jump into their car and drive to the hospital. But I just had a really interesting thought, and this is where we need data from the hospital. If by chance this is actually a daily thing, I mean, every night, well, in big cities, you have taxi cabs lined up at the airport and at hotels. You just walk out the door, there they are. Because sooner or later, someone's going to need them and hire them. Instead of having the driver be staying at home all night waiting for the phone call, if this is an every night thing, maybe the driver stays at the hospital. They're just there waiting for the person to be released. I don't know, that might be more expensive than the alternative, but.
Well,
do
and
think-
sorry, you go, Matt.
I do think that it is intelligent for us to correctly assess the level of need. Because if we can determine, I mean, everything we've got so far is anecdotal. And we all have our own anecdotal information that we're bringing to the table. If we were to get more information and then find that this need is much more widespread than we knew, that might serve as kind of an incentive to get a grant involved, get the city more involved. Because it's really an unknown need largely. But I do know, like just yesterday, I was transporting a veteran that I serve and I transported him 3 different times to 3 different places. And then I had to ask him how he's planning on getting home because I'm dropping him off at the end of my shift for the day. And he said, well, I have so-and-so give me a ride. I said, well, and I said, does he do it for free? And he's like, no, I pay him. And I said, well, how do you pay him? Because he doesn't have any money. I know this. He says, well, I owe him a bunch of money. And so like, this has been deeply on my mind in the last 24 hours as well.
Wow.
And so he's disabled, he's a veteran, he's in our community, we are serving him, and he doesn't have access to the community. And in this case, this is a court order meeting that he had to attend at this time. And it does get over in that 8 to 9 p.m. window. So he's disadvantaged. But
Odds are stacked against
yes,
And he's in Lewiston,
yes.
because Asokan County has money to pay
He
veteran transportation.
is in Idaho, and he actually doesn't have a choice. He needs to stay in Idaho, unfortunately.
Yeah.
But that is a constraint that he has on him, on his own life, and his own opportunity to be successful with his plan that is required of him is limited now because of this particular situation.
I'm wondering if the city could offer a grant to a transportation company. Because I know for a fact that cabs are available at 2 a.m. So if you could prove,
Cabs are available until 2 a.m.
oh, past that. Have you ever gotten drunk at a bar, Mark?
No, not that I needed someone to drive me home, but, I mean, that kind of touches on what I was saying. If we came up with an infrastructure to serve disabled people after hours,
The community at
problem-
large.
there could be the community at large, there could be added demand. The reason that Ubers are so robust up in Moscow and Pullman, where they have a lot of Uber drivers, is exactly what you just brought up, Constance. It's to drive people home from bars. I don't know if you needed an Uber at 10 in the morning, if there'd be one available, but there's lots of choices in the evening, or so I've been told, about that. But for some reason, that just hasn't developed as an industry in the valley here. Maybe they're not aware of it. I'd be curious, when you brought up, Jessica, the idea that, you know, some people, all kinds of people, but people with disabilities, if they have no rights, they have to turn down jobs in the evening, you know, the after hour times. Would the economic development organizations in town, would this concern them? Maybe not, the Valley Visions and CETA and SWETA. Would it concern them that it's a labor force issue, maybe even the employment agencies? You know, that this is something that collectively, if we could figure out how to solve it, could definitely have greater benefit to the overall community. Well, as I said, I didn't expect solutions to come out of this meeting, just to document the problem.
Well, I am thinking too, I think back to the taxi type services that I feel like I have seen in the past where there is a certain night out of the year where taxi service is free. Because maybe it's like St. Patty's Day or something where they know that there are going to be a lot of drunk drivers. And I'm just interested in who paid for the services. Because you know, a cab company is not going to say, hey, tonight we're off the books.
Eric Peterson?
Eric?
Yeah, I had asked to be recognized quite a while ago, and I'm just kind of bringing back that issue. Because I have a short-term memory, I have to write things down, an issue with my memory. One is, I'd like to move to have put on the next agenda a goal-setting, meeting for the board DAC for this year.
I'm sorry.
And
I'm not quite sure I understood what you said.
okay, well, I'm not sure I can do it because it's calling for a vote, but put on the agenda for the next meeting, goal setting for DAC for the year with a vote.
Right.
It's just a request from me. We can't vote on it. We have to wait
So
till next
so
meeting.
you would like to put on the agenda.
A goal setting, have a goal setting meeting for DAC with a vote on that time and place, the next meeting.
Yeah, that can be an agenda item,
Yeah.
is to set goals for 2025.
Yes, with action item.
Okay. Well, I will. We don't have to vote on that motion though now, right? We can just put that on
Yes,
the
Yeah, I think it
action.
should be a request.
I'm just saying the two that I'm addressing. Oh, shit. We've got a fire alarm. I'm counting on a spider until I finish this. One thing is, we're talking about rides, and one of the things I learned quickly becoming disabled 12 years ago was I had to ask people for help. That was very difficult. One of the hardest things to do when you go from able to disabled is asking for help instead of giving it. And one of the things I've learned quickly is that a lot of your friends and other people will say, you ever need a ride, just give me a call, no problem, whatever. Yet in reality, that is not a viable model for getting places. Most of the times when I did reach out, they were sorry they had other options or other obligations at that time and other issues. So in a lot of the way, that's one of the reasons I became very independent with signage and other issues, because it simply just wasn't a viable area. Families working, et cetera. So when people say we'll just rely on family, as it's often done in political areas, that family and friends, no, it's not a viable, workable thing. So what Mark's been talking about, I think, is much more appropriate. Now I gotta go check and see if there's a fire. I'll be back.
Okay.
Jess?
Thinking out loud again about the transportation thing. I really don't know a lot about grants and how any of that works, but it would be nice if certain organizations, facilities, groups, things like that did have access to some type of fund. You know, I think of things like Special Olympics. They scramble as much as they can just to get the volunteers for the coaches. And then I've got several participants of mine that would love to participate in sports, but right now they're doing bowling. Bowling is on Sundays. Bowling is in Clarkston, and it's from 9 or 10 to whenever. And so unless they have a personal ride that can get them there, there's just no way for them to be able to participate. But with that kind of being its own group, you know, just kind of thinking like, what if they had some incentive to get more volunteers to be able to provide that also, like, this is when we're gonna have practice and we can go around and we can pick up everybody who wants to come and bring them to that, but I just don't know how grants and stuff like that work, so.
Well, and that's why I was thinking about like how cab companies can afford the free nights. Like they have to get that money from, is it a grant? Is it from the city? Is the city saying, hey, we will pay the cab fare for this night so that we keep drunk drivers off the streets?
Right.
Because I like where you're going with that, Jess, because that, yeah.
And even like residential assisted, like living facilities, things like that, if there was some way, like sometimes I have to help the people that I serve. I remember one time just the OUI dance or something. I've set up for one of my fellas to get a ride to the banquet, but I had to schedule in advance with a local cab company, and that did work. It was like $40, I think, for him to go to this one event. And I mean, trying to do that for a bunch of people might not work if it was just like me trying to set it up by myself for all the people, but it just kind of makes me think of how that would be done the most easiest to help people more, but there's a lot of, and I guess it all kind of comes back to that needs assessment, you know? What type of activities are people needing to get to, how often, after hours, things like that. But
Well, and maybe,
Running out of time.
oh, sorry, Mark. You go, Mark.
No, I think we're running out of time and this discussion can go in a lot of different directions. This is
Oh
what
yeah,
happened.
we did
So
not
having-
really stay on track today.
yeah.
Well, I think I like Eric's suggestion of a goal setting for next meeting. And I think I have some avenues to check about potentially with transfer. This felt like a brainstorming session and I liked it. Are we good to move on so that we can?
Yeah.
Now we have.
All right, so say again, Eric? No fire?
No fire.
No
I
fire.
move we accept the meeting minutes from September 12th as written.
I second.
All right, any discussion? All approved?
Aye.
Aye.
And I'm gonna say no nays, or any nays, no nays. So moving on, so future agenda items, Eric had already suggested a goal setting meeting. Anybody have anything else that they would like to address in November?
Not at this time.
No.
All right, any commissioner comments? Anything from staff, Nikki?
Nope, I've got nothing.
Well, perfect. We are adjourned.
Thank you.
Have a good day.
Have a great day.